Hi friends, good morning one and all of you. My name is Rasne Somnath, lecturer from Pravara Medical Trust, College of Pharmacy, Shivgaon. My subject is pharmacology and toxicology. Today we are going to discuss here the unit is the name cardiovascular drugs, and that unit contain various chapter like that digitalis and related glycosides, anti-arrhythmic drugs, anti-hypertensive drugs, vasodilators and anti-anginal drugs, and last is drugs used in atherosclerosis. In previous lecture, we show the above three chapters like 1, 2, 3. Today we are going to discuss only this chapter is the name is, that is vasodilators and anti-anginal drugs. Vasodilators and anti-anginal drugs, this chapter are conducted in cardiovascular drugs unit. So this chapter contains introductory part, classification of anti-anginal drugs, then mechanism of action of drugs, pharmacological action of drugs, adverse effect, therapeutic uses, and another effect of anti-anginal drug. So these points are covered today topic. First, introduction of angina pectoris. Angina pectoris, it's a symptoms resulting due to cardiac ischemia. Angina pectoris is not a disease or disorder, it's only symptoms that resulting to cardiac ischemia. Cardiac ischemia means cardiac heart coronary heart disease, means damage or disease in heart major blood vessels. In that present in the body the various blood vessel, and the blood vessel having to damage or disease or any injuries about this blood vessel to create this disease like cardiac ischemia, and that's having showing the symptoms of angina pectoris. Angina pectoris, it's a condition in which there is a compressing type of pain in the chest. This angina pectoris having the symptoms of cardiac ischemia disease or disorder, and this angina pectoris having there are compressing type of the pain in the chest. It show having that chest in the pain are the created in a chest. So then the coronary vasodilators are useful in the treatment of angina pectoris. These coronary vasodilators किंवा anti-anginal drugs are the useful in the treatment of angina pectoris. So see next slide, classification of anti-anginal drugs. There are the four classes of anti-anginal drugs for the treatment of angina pectoris. First class is that is nitrates and nitrates. There are example of amyl nitrate, glyceryl trinitrate, erythritol tetranitrate, pentaerythritol tetranitrate, and last is isosorbide dinitrate. These are the example of nitrates and nitrates. Second class is that beta adrenergic blockers. These beta adrenergic blockers example that is propranolol. These are the example of beta adrenergic blocking agent. Then third class of anti-anginal drug is that is calcium channel blocker. This calcium channel blocker class consists about the various example like that nifedipine, verapamil, and deltazem. Then last class of anti-anginal drug is that is potassium channel openers, and that potassium channel opener, that is example is nicorandil. This is all about the classification of anti-anginal drug for the treatment of angina pectoris. One by one are they discussed here. This classification: first, nitrates and nitrates. These nitrates and nitrates, pharmacological actions of these nitrates and nitrates. First is on the blood vessels. These nitrites and nitrates are the administration in orally, sublingually or inhalation by to create the various pharmacological action. So one by one discuss here this pharmacological action on the body. First action on the blood vessel of these nitrites and nitrates consist about the various drug like that glyceryl trinitrate, isosorbate dinitrate or amyl nitrate. The first action is that is blood vessels. These compounds or these nitrates and nitrates compound produce the direct relaxant effect on arteries, veins and capillaries. These drug administration in the body to directly relaxant effect on the arteries, veins and capillaries are the present in the body. So it's having decreases the blood pressure, decreases the hypertension of the blood in the body. Second, there is no involvement of autonomic nerves or receptors. These nitrate and nitrate are not involvement in autonomic nervous system or receptor. Then these nitrates and nitrates are the all blood vessels are not equally affected. These nitrate compound like that amyl nitrate, glyceryl trinitrate are not equally affected to all about the blood vessel in the body. Then vasodilation is a marked effect of these nitrates and nitrites compound in that coronary blood vessels, cerebral blood vessels and cutaneous vessel. These vessels are the markedly vasodilation by using these drug nitrites and nitrates. Then these nitrites and nitrates drug are administration in the body, so that having increases the blood flow and that but decreases in blood pressure is minimal. That having increasing the blood flow of the in the patient, so that having produced the angina pectoris, but that having decreases the blood pressure is minimum. This is the pharmacological actions of nitrites and nitrates on blood vessels. So see next slide. On a next organ like that smooth muscles, nitrites and nitrates produce the relaxation of smooth muscles like intestine, biliary tract, ureter and uterus. These nitrites and nitrates are that having producing the relaxation of smooth muscle is present in that intestine muscle, intestine smooth muscle, biliary tract smooth muscle, ureter smooth muscle and uterus smooth muscle. These smooth muscle are the dilation or relaxation by using these drug. So it's having vasodilation or anti-anginal drug or nitrites and nitrates drug. Then third number, pharmacological action of nitrate and nitrites on the eye. These drugs dilate the intraocular blood vessels. These drug having dilation of intraocular blood vessel and so intraocular pressure may be increases. In that administration of these drug, so produce the intraocular pressure and that having producing the glaucoma disease or disorder. In see next slide, methemoglobin formation. These nitrite and nitrates drug having another one therapeutic effect or another one is a if effect is like that. These nitrites convert the hemoglobin to methemoglobin. These nitrites drug, these nitrite drug consisting various drug like that amyl nitrate, glyceryl trinitrate, all these drugs are used to that treatment of cyanide poisoning. By using this nitrite converts the hemoglobin to methemoglobin. These nitrite drugs is the conversion of hemoglobin to methemoglobin, and methemoglobin combining with cyanides. This cyanide having a poisoning, that's combining with methemoglobin with cyanide and to form non-toxic cyanomethemoglobin. So, nitrates are useful in the treatment of cyanide poisoning. So, these nitrites are the useful in the treatment of cyanide poisoning. Cyanide is one of the chemical that having to create the poisoning, and that having treatment of this cyanide poisoning by using this nitrite and nitrate drug. By using this mechanism, this nitrite convert the hemoglobin to methemoglobin, and methemoglobin combining with the cyanide and to form the create a non-toxic cyanomethemoglobin. So these nitrate or nitrate drugs are useful in the treatment of cyanide poisoning. So see next slide. Adverse reaction of these nitrate and nitrates drug: headache, flushing of the face, hypotension because it's having a dilation of the blood vessels, that having leading to dizziness or fainting. This is the adverse reaction of nitrates and nitrates drug. See next slide. Preparations and doses of nitrates and nitrates drug like that amyl nitrate pearls. Amyl nitrate pearls, these are the volatile liquids. It is a dispensed in fragile ampoules to be broken open in handscrews and inhale the vapor. These amyl nitrate pearls are the preparation by inhalation route. It is a drug of choice in angina pectoris. These drugs are choice for the angina pectoris patient. The effect is a very short lived as it quickly decomposes and excretes as alkaline nitrate and nitrate. And these amyl nitrate pearls are the dose is only 0.1 to 0.3 ml by inhalation route. These amyl nitrate pearls are the volatile liquid. Then second preparation is that glyceryl trinitrate tablet. Glyceryl trinitrate tablet, it also having known nitroglycerin. This nitroglycerin is a yellow explosive liquid, and the tablet are for sublingual use and readily absorbed. These glyceryl trinitrate or nitroglycerin tablet are the sublingual tablet by using readily absorbed. The action commences in a few minutes. The lowest through the blood pressure is reached in 15 minutes and recovery is complete in hours. There is absorption through the skin is also. It becomes an industrial hazard of this nitroglycerin drug, unlike amyl nitrate. Amyl nitrate सारखा हा hazardous drug नाही आहे इंडस्ट्रियल मध्ये. These are the amyl nitrate. It is not destroyed by the gastric juice. These triglyceryl nitrate or nitroglycerin are not destroyed in gastric juice. So these glyceryl trinitrate are the administration by sublingual route by using doses 0.2 to 0.6 milligram. Then third preparation is that erythritol tetranitrate tablet. Erythritol tetranitrate tablet, its having dose is 5 to 10 milligram by administration on sublingual route. And then last preparation is that pentaerythritol tetranitrate, is that Dose is 10 to 30 milligram by administration by orally. This is the preparations and dose of nitrates and nitrates. See next slide. Second class of the anti-anginal drug, that is beta adrenergic blockers. Beta adrenergic blockers, these are the blocking drugs. Beta adrenergic blocking drugs like that propranolol, it's have an anti-anginal effect. This propranolol have an beta adrenergic blocking drugs, and these drugs showing the anti-anginal effect. These drug or this propranolol drug act by the preventing the response of heart to sympathetic nerve stimulation. This propranolol drug, it's having preventing the response of heart to sympathetic nerve stimulation, and so the effect of adrenaline on cardiac rate and force of contraction is prevented. That having adrenaline, that's having action of the adrenaline, the cardiac rate and force of contraction is preventing by this propranolol drug, like that beta adrenergic blocking agent drug. This propranolol is a prophylactic in the treatment of angina pectoris. This propranolol are the prophylactic in the treatment of angina pectoris. Then third class is that calcium channel blocker. Third number classification of anti-anginal drug, that is calcium channel blocker. Contractility of cardiac and vascular muscle depending on extracellular calcium concentration. कार्डियकचं जे काही कॉन्ट्रॅक्टिलिटी आहे, कार्डियक किंवा त्यांची व्हॅस्क्युलर मसल, त्यांची पूर्णपणे जी काय कॉन्ट्रॅक्टिलिटी आहे ती डिपेंड्स आहे कॅल्शियमच्या कॉन्सन्ट्रेशननुसार. त्यामुळे कॅल्शियम चॅनल ब्लॉकर, कॅल्शियम चॅनल जे काय ब्लॉकिंग ड्रग्स आहेत लाईक दॅट व्हॅरॅम्पॅमिल असेल, निफिडिपिन असेल, हे जे काय कॅल्शियम चॅनल ब्लॉकिंग एजंट आहेत इंटरफिअर विथ द कॅल्शियम एंट्री इन टू मायोकार्डियल अँड व्हॅस्क्युलर स्मूथ मसल. These agents are the prevent or interfere the entry of calcium into the myocardial and vascular smooth muscle, and so this decreases the availability of intracellular calcium. त्यामुळे त्यांच्यामध्ये इंट्रासेल्युलरची कॅल्शियम जी आहे तिची अवेलेबिलिटी डिक्रीजेस होती. द अँटी अँजायनल इफेक्ट ऑफ कॅल्शियम चॅनल ब्लॉकर इज ड्यू टू, त्यामुळे काय होईल, जर कॅल्शियम तिथे अवेलेबिलिटी नसेल तर डिक्रीजेस ऑफ अवेलेबिलिटी इन द मसल, सो इम्प्रूव्हमेंट इन कोरोनरी ब्लड फ्लो. त्यामुळे जो काय ब्लड फ्लो आहे ब्लड व्हेसलमध्ये तो इम्प्रूव्हमेंट होईल आणि डिक्रीजेस इन सिस्टमिक व्हॅस्क्युलर रेजिस्टन्स अँड ब्लड प्रेशर. दिस डिक्रीजेस ऑक्सिजन डिमांड ऑफ हार्ट. दिस इज दी anti-anginal effect on calcium channel blocker, improvement of coronary blood flow and decreases in systemic vascular resistance and blood pressure, and this decreases oxygen demand of heart. This is the third number class of anti-anginal drug, is that is calcium channel blocking. There are various drugs are present. Show see next slide. Verapamil. Verapamil, it's a calcium channel blocking agent drug. It is the synthetic papaverine derivatives. It produces the coronary vasodilation and anti-arrhythmic effect are the show. It is a well absorbed from the gut, or it is a well absorbed from the orally route, but it undergoes first pass hepatic metabolism. These verapamil are the used in the treatment of anti-anginal symptoms or anti-anginal disorder or anti-arrhythmic effect. These verapamil are the produce coronary vasodilation effect. These verapamil are the various contraindication. Verapamil, these drug are do not combining or do not administration to these criteria. This verapamil drug is contraindicated with beta blockers and digitalis. These verapamil drugs are do not combining with beta blocker or digitalis drug. This verapamil drug do not administration to the patient is a severe from congestive heart failure. The patient is suffering from severe congestive heart failure, so that patient having not administration to verapamil, this is the contraindication to that patient. And then cardiogenic shock. This verapamil is also having a contraindicated with cardiogenic shock patient. Cardiogenic shock means it is the condition in which your heart suddenly cannot pump enough the blood. This cardiogenic shock, that is the condition in which your heart suddenly cannot pump enough the blood to meet your body needs. So that's the name called, this is cardiogenic shock, but these are the rarely condition, and these are the contraindicated of this patient to this verapamil drug. Last, dose of verapamil is, that is 40 to 80 milligram 3 to 4 times daily as a tablets. This verapamil dose is 40 to 80 milligram 3 to 4 times daily as a tablets. Then next drug, so see next slide, is that nifedipine. Nifedipine, it is also having a calcium channel blocking agent drug. It is a dihydropyridine derivative drug. It is used in variant angina refractory to nitrate. Nifedipine, it is a potent inhibitor of platelet aggregation. Nifedipine, it is also used in a platelet aggregation, that having an inhibition of platelet aggregation. It is used in angina pectoris. It's showing the produce vasodilation. And this nifedipine having an adverse reaction like that headache, tachycardia, fatigue, orthostatic hypotension, and gingival hyperplasia. Gingival hyperplasia, these are the condition. It is an overgrowth of gum tissue with around the teeth. There are no causes for this condition, but side effect of various medication to produce the gingival hyperplasia. These gingival hyperplasia are the adverse effect of nifedipine. The gingival hyperplasia means overgrowth of gum tissue with around the teeth. Then dose of nifedipine. The dose of nifedipine is that 5 milligram 3 times daily by mouth, or gradually increases up to 20 milligram 3 times a daily. Nicardipine, felodipine, and nimodipine have a similar action as nifedipine. Another drug like that, nicardipine, felodipine, and nimodipine, that having a similar action as like nifedipine. See next slide, or next drug is that is deltizam. Deltizam, it is also having a calcium channel blocking agent drug. It is a less potent vasodilator than nifedipine. These deltizam are the less potent vasodilator than nifedipine. This deltizam, it's having the negative inotropic effect is moderate. The negative inotropic effect means the negative inotropes weaken the heart contraction and slow the heart rate, is moderate. And this negative inotropic effect having a decreases the force of contraction of the heart, and that that are treatment with deltizam. This deltizam, it can produce bradycardia. Bradycardia means decreases the heart rate. So it can be combined with beta adrenergic blocking agent. So त्यामुळं deltizam हा जो काय ड्रग आहे, इट्स कंबाइनिंग विथ बीटा adrenergic blocking. These deltizam are the produce negative inotropic effect, not treatment. Deltizam are the produce negative inotropic effect, means force of contraction decreases the force of contraction of the heart, and so it can produce decreases the heart rate by using this by bradycardia. So this deltizam combining with beta adrenergic blocking drugs, dose of deltizam is 30 to 60 milligram 3 or 4 times a daily. So see next slide. Last slide. Fourth number class of anti-anginal drug, potassium channel opener. That the drug is nicorandil. This is the it is in drug. It's having a novel anti-anginal drug. This drug activates the ATP sensitive potassium channel and that having produces the hyperpolarization of vascular smooth muscle and leading to vasodilation. पोटॅशियम चॅनल ओपनरमुळे काय होईल, हायपरपोलरायझेशन क्रिएट होईल व्हॅस्क्युलर स्मूथ मसलचं आणि त्यामुळं व्हॅसोडायलेशन क्रिएट होणार आहे. इट प्रोड्युसेस arterial and venular dilation. This potassium channel opener drug, like the name that is nicorandil, it's having produces arterial and venular dilation. It also having increases the coronary blood flow. Adverse reaction of nicorandil is that is flushing, palpitation, headache, dizziness, nausea and vomiting. And dose of this nicorandil that is 5 to 20 milligram twice a daily. This is all about the anti-anginal drugs. Are you sure up to here? So next point uploaded in next lecture. Thank you so much.